Imagine a world where surgeons can practice complex procedures on realistic beating hearts. This is no longer a fantasy. Thanks to cutting-edge 3D printing technology, we are witnessing a revolution in medical training. Researchers at Nottingham Trent University have developed incredible 3D printed heart and lung models. They can bleed, beat, and even breathe, mimicking real organs with astonishing accuracy. This breakthrough is a game changer for surgical training. Traditionally, surgical training relied on cadavers and animal organs. These methods have significant drawbacks. 3D printed organs offer a realistic and ethical alternative. They bridge the gap between theory and practice. Highly customizable and reusable, they are cost-effective. They eliminate ethical concerns, paving the way for compassionate training. These 3D printed organs are more than just static replicas. They are complex systems designed to mimic the functions of real organs. But how do they actually work? The process starts with gathering detailed CT scan data from real patients. This data is then fed into sophisticated 3D printing software. The software uses this data to create a blueprint for printing the organ model. The printing itself is done using advanced 3D printers and specialized materials that mimic the texture and properties of human tissue. The heart models, for instance, are designed to pump fluids, simulating blood flow. The lung models are designed to expand and contract, simulating breathing. These models can even be programmed to simulate various medical scenarios. For instance, surgeons can practice stemming blood flow during a simulated heart surgery or learn how to connect blood vessels with precision. Section 4, Beyond the Beating Heart, Other Applications of 3D Printing in Medicine. The use of 3D printing in medicine extends far beyond surgical training. This revolutionary technology is transforming various aspects of healthcare, from research to patient care. For instance, researchers are developing 3D printed models of other vital organs, including kidneys, livers, and even bones. These models are proving invaluable in medical research. Scientists are using them to study organ function in greater detail, understand disease progression, and test new drugs and therapies. For example, researchers are using 3D printed models of tumors to develop more targeted and effective cancer treatments. Three-dimensional printing is also revolutionizing medical education. Medical schools and training institutions are increasingly incorporating 3D printed models into their curriculum. This allows students to gain hands-on experience with human anatomy and practice procedures in a safe and controlled environment. The tactile nature of these models enhances learning and helps students grasp complex concepts more effectively. Section 5. The future of healthcare. Personalized and precise. The advancements in 3D printing technology have opened up a world of possibilities in healthcare. As this technology continues to evolve, we can expect to see even more innovative applications. One of the most promising areas is personalized medicine. Three-dimensional printing allows for the creation of custom-made medical devices, implants, and prosthetics tailored to the unique needs of individual patients. Imagine a future where patients with bone defects receive perfectly fitting implants designed from their own scans, or where children born with heart defects have personalized heart valves printed to support their growth. Another exciting area is bioprinting. This cutting-edge technology uses living cells as ink to print functional organs and tissues. While still in its early stages, bioprinting has the potential to revolutionize organ transplantation, eliminating the long waiting lists and the risk of organ rejection. Section 6. A new era of medical innovation. The advent of 3D printed organs marks a new era in medical innovation. This technology is not just transforming surgical training, it's reshaping the entire landscape of healthcare. From personalized medicine to groundbreaking research, the possibilities are endless. As we move forward, we can expect to see even more incredible applications of 3D printing in medicine. This technology holds the key to solving some of the most challenging medical problems and improving the lives of countless patients worldwide. The future of healthcare is here, and it is being printed one layer at a time.